Being a refugee and a community health worker have given me a renewed purpose despite having been displaced from my own country. But it doesn't come without its share of struggles.
As of August 2023, Malaysia hosts an urban population of approximately 182,820 registered refugees and asylum seekers, 27% of which are minors under the age of 18. Most migrate to Malaysia due to war or persecution in their country of origin.
Like many others in host countries around the world, refugees in Malaysia also face significant daily challenges, including the fear of arrest and detention, the lack of access to formal work, limited financial means to support their families, as well as anxiety over the uncertain futures of their family and especially their children. Crowded living conditions also further compound their difficulties. Research has consistently shown that these psychosocial stresses faced by refugees before, throughout, and after their migration journeys can result in a higher risk of common mental health problems. This demonstrates the growing need to improve the mental health literacy among refugees.
Health literacy involves achieving of a level of knowledge, personal skills, and confidence to take action to improve personal and community health by changing personal lifestyles and living conditions. Thus, health literacy means more than being able to read pamphlets and make appointments. It is about creating enabling environments and empowering communities.
From the perspective of refugees here in Malaysia, we have some real challenges when it comes to health literacy. One of the biggest hurdles is that all health informations are available in local languages. For example, Malay, English, Tamil, or Mandarin. And this makes it difficult for the refugees to understand and access the accurate information that they need, and it also deters them from seeking out health services. Another significant challenge we face is trouble communicating with local healthcare providers. Now that can bring in misunderstandings about the refugee health condition and treatment. This can further lead to more stress, concerns, and worries. Low-level health literacy may also be more prominent among those who have just recently arrived into the country. In addition to that, cultural norms, stigmas, and beliefs can be a big barrier too, especially when it comes to mental health. Within the refugee community itself, some refugee women have lesser opportunity to engage socially, through which they may actually obtain information. Refugee men, on the other hand, fear the stigma of being labeled as weak or not being able to fulfill their duties. Despite all these challenges, more and more organizations have been stepping in to bridge the gap and to improve health literacy by providing community-based support and interventions.
Health Equity Initiatives collaborates with various stakeholders including non-governmental organizations, refugee community-based organizations and learning centers, UNHCR, Ministry of Health, and WHO to provide community-based mental health services. They also train community health workers from the refugee communities.
When we were thinking of setting up health equity initiatives, we wanted to set up a program that led to the empowerment of the community, to focus on the formation of refugees as community health workers so that they could continue that work in the community. And so it was from this that the first community health worker training on mental health was established in 2008. Currently, we have a team of 11 community health workers from different countries of origin. We are currently serving a caseload of about 250 refugee patients in our clinical services. We have trained about 175 community health workers and reached out to about 18,800 refugees in our community-based mental health services.
HEI CHW training equipped me with the necessary knowledge to promote mental health awareness. The skill that I've learned in the training include listening and attending skill, because this is necessary, it's important when providing emotional support. Also, to be able to create a safe and non-judgmental environment for people struggling with mental health problems to speak out their problem. I have one of my friends is from my community. He has been going through a lot and he was having some trauma. With the training that I've attended here, I had some sessions with him and I tried to encourage him. He's now living his life happily, knowing that, yeah, there's always time for everything. If life presses you harder today, tomorrow you'll be in a better position. I will always appreciate and consider that this is a great opportunity for me and for my community members as well. I was welcomed. I felt at home.
We fulfill many tasks like bridging language gaps. We also support refugees through various other tasks. We translate for psychiatric and psychological interventions. We provide psychoeducation, refers the patients to appropriate services, and make sure the patients adhere to their treatment plan by making regular check-ins. We also conduct community outreaches to raise awareness to our fellow community members about mental health issues, signs and symptoms, and coping strategies. By giving them pre and post tests before and after the outreach sessions, we are able to assess their increase in mental health awareness. Refugee community health worker like myself comes from diverse background and reflects in the various communities and ethnicities HEI serves. I believe what makes us more effective in this role is that we speak the language native to the refugee communities. But this is more than just a language. It's about the shared experience. It's about the barriers we go through as refugees. This shared experience helps us to connect and build the trust within the communities when we reach out to them.
It is evident that local community-based efforts, in collaboration with the Ministry of Health, play an important role in supporting refugees. We've seen the positive impact of reducing barriers to care, ensuring that everyone, regardless of their background, can access the support they need. We hope, together with the global community, to continue to improve and support the health literacy of refugees and migrants worldwide.